is a non-hydroquinone brightening cream.
All right, Dr. Emer, we're live.
Yeah. Hey guys, it's Dr. Emer. We are Saturday morning. Can you believe that? Saturday morning already. I don't know how we did this so quickly in New York with my gorgeous client. Look at her skin. It's so radiant. Because and that's why we were just talking in the midst of Jordan starting this live. Because we can't stop talking about skincare. We're talking about all of our products that we're using. Look at the smoothness in her skin and the radiance. Look at the decrease in pores. And why are we getting that? Because she's really following a detailed skincare regimen, doing peels like our Cosmelon and Aerify, and also following our in-office treatments, these lighter treatments that just lightly resurface, decrease oil. You can see the AEROLASE here. This is our 1064 YAG. I love this on my darker skin clients, anyone that has acne or hyperpigmentation. It even improves blood vessels. So if you have redness or vessels on your skin like rosacea, this will improve it. But the other thing it does is it decreases oil.
Someone said, when are you coming to ATL, guys? We will not be in Atlanta, but we're going to be in Florida, which is pretty close. So come see us in Boca, send us a DM, full name, email, and phone number. Someone said the best one.
It also decreases hairs. So she has some hairs on her skin, which a lot of women have, vellus hairs, so that will get rid of that. You guys can see.
That's the smoke that they're talking about.
So you have to do really small sections, nice and slow and meticulous. We often combine this with lasers, which is what we're going to do today. And I think with her, I was talking about my skincare regimen. So I guess this is actually a good time for me to tell you how extensive my skincare regimen is. If you look at my face right now, I can't look with her, you can show them. Am I red? Yes.
You're red.
I'm doing a peel right now. I'm using Cosmelon 2, one of the strongest lightening creams that's available. It's made with hydroquinone, retinol, salicylic acid, kojic acid, lactic acid. There's many ingredients in it, and those help brighten the skin. So that's something I would have her do a couple times a week. I'm doing this as a peel. Let me just tell them a couple seconds. Also, my stem cells, so I always use anti-age. I use the serum and the brightener every day, and I use the accelerator at night. The accelerator has the crucial in it, which also is an alternative to vitamin C and retinol. If those that are allergic to vitamin C or retinol, it can help. And then I also do other little things, like we were talking about the Jan Marini Skinzyme mask. I love that. I do it a couple times a week in the shower. I'm using my refit peptides around my eye and my face, so refit face and eye. And then recently, we just introduced an amazing hyaluronic acid for those that don't have Hyla B, because it's not out yet. So you obviously are going to be using my botanical serum, which is my green serum. Mix that with the Isden hyaluronic concentrate. It's an unbelievable plumper. Love that cream. So, okay, what was the question they were asking?
All right. We have some travel requests to Chicago, guys. You have to come see us. We're not going to Chicago right now. Send us a DM. Someone said, when are you coming to Dubai? Right after he leaves New York, he's going straight to Dubai.
Yeah, make sure that if they want an appointment, they need to
you guys need to send us a DM, full name, email, phone number. We have to get your consult done right now before we leave. Rosa, we have Spanish here. Can you please?
Eres el mejor. Me encanta tu trabajo. They're saying you're the best and they love your work.
Oh, thank you so much. Now tell them, if you guys want virtual consults, you can get EmerCosmetics.com.
And in Spanish with Jonathan.
Who?
Just tell them we have consults and in Spanish.
Si quieres un consulto lo puedes hacer en línea. Podemos hacerlo virtual y hacer una video. What do you send it to? Y puede mandar un correo electrónico con toda su información, el nombre, teléfono y el correo electrónico.
Alright, someone said, I need this. Always have been afraid of lasers because I have dark skin.
Well, this is a good learning experience because even a lot of women even have little straggler hairs. You guys, I showed you on the forehead, she has a little on her chin even. This area is very difficult to treat with hair removal, but not with the AEROLASE.
Someone wants to please pin the peel that you were talking about. You guys
go to AEROLASE.com.
It's in our bio.
Type in, there's 3 different peels we carry: Enlighten, Cosmelon, and Aerify. My opinion is if you want a little bit stronger, like I'm doing right now, do Cosmelon and then do my Aerify kit every 2 weeks afterwards. It's definitely something. Now, in the Aerify kit, there's a product we were just talking about called High Spot. High Spot is a non-hydroquinone lightening cream. It's a vitamin C based, peptide based, botanical based, not a brightener of the skin. And that will be coming out in full size in 1 month.
That's my personal favorite.
So we do have, though, for those that get worried about hydroquinone long term, we have a Rev non-hydroquinone lightening cream that's on Emerage Cosmetics, and Restore C 10X lotion is one of the best non-hydroquinone lightening creams with the anti-age brightener, because those use other products like the cuchiol, fish enzyme, vitamin C to help brighten the skin without bleach.
Okay. Those of you that want pricing on treatments, send us a DM, full name, email, and phone number. And then someone's asking, what is the difference between this and a 1064 Q switch?
That's a very good question. This is a very quick pulsing. We call this microsecond. Q switch will burn her skin. It will actually cause her to get white spots because she has brown skin. If you ever use a Q switch on a brown skin patient, I'm going to slap you in the face, because you should never do that unless they have a tattoo or there's a very, very specific reason. You should not be doing that. It will harm their skin and sometimes cause permanent hypopigmentation. People have seen me doing that for birthmarks like nevus obota, for example, which we have to do that. But in this case, we would never do that, not to this beauty. So turn all the way to the right. There we go. See right there. Perfect. So now we're going to work on the other side. You guys see I'm working in areas there's some hairs, because some women, as they get older, they develop some hormonal changes and hairs can pop out. So a couple treatments of this in, and these should be gone. And then she's going to follow a regimen. Now what we've been doing is AEROLASE followed by my Aerify, which I love. So she can keep doing that and then keep using skincare. She looks like a model. It's very important with AEROLASE. You go really slow and take your time. Otherwise you don't see the results. And remember, Q switches, again, they attract pigment. Their chromophore is pigmentation. With the microsecond YAG, the chromophore is underneath the skin, past the pigment. The thermal relaxation time is so quick that it's not going to hit the melanin that produces in the skin. So give her all the energy without the risk of damaging her skin. I love that. What else were they saying there, Jordan?
No more questions right now.
So let's go back to the skincare. So
let's tell them.
Like you said, so we also added a product. It's not on the website yet, but it will be there in a week. Is a phyto corrective spray. So it's a spritz, and it has in it botanicals that calm the skin. So post laser, it's really good if you're redness, if you have sunburn, you have flares, you're going out before the night, you want to set your toner, set everything into the skin before you put your products on.
What is that?
It's made by SkinCeuticals.
Okay.
It's amazing. However, what you don't know is my mist is coming out next month too. It's been in development for 2 years. It's a botanical spray with a enzyme in it that helps exfoliate the skin, and it's unreal. Everyone loves it. So it's going to be a part of the regimen. I'm going to kind of get people involved in cleansing, then using my pads, then spritzing, little mist, then you put your products on. Serums before creams, before sunscreen, before makeup.
Right, like lightest to heaviest.
Exactly, lightest to heaviest.
I've been studying that.
You're good. You're real good. Well, that's why you look so good.
Well, you changed my skin. I brought my old pictures.
Oh, you did?
With my dad's skin, so you could see. Like,
Well, you look great.
Thank you. Because of this.
It's much harder to with darker skin, so it's important. You gotta go slow and, really work hard at it. Turn a little left, just a little bit. Yeah, there we go. See, we're getting all the hairs. You could see them reacting. Turn to the left now more. Good. For those that have acne, this is really, really good. For acne, actually all my Accutane patients, I have them doing this while they're on Accutane. And I'll turn all the way right from you. There we go. Now we're going to work on neck tightening by building up the dermal heat in the skin with the microsecond energy. She will get tightening of the skin, brightening of the skin, more even tone. So I just say, you know, complexion blending is what we're trying to do here.
Do you want to wrap up?
What? Yeah. So that's AEROLASE, you guys, and darker skin, but overall rejuvenation for all different types of skin. The reason I love this is it's versatile, no downtime. People look great right afterwards. Keep following me. Bye. And it's